So we still want to look at fourfold clinical insights, but we're going to look at the next two levels. The levels of quality and a level of meaning. So if we go back to our study of decreasing human body temperatures over the last 140 years, we can look at the facts and the measurements of warmth, and we can look at dynamics and patterns of warmth. The next step is going to be look at differentiated qualities. Are there qualities of warmth? And are there archetypes of warmth? So these are thermograms. This is from a study, I think 3 years ago, from some colleagues in Europe. What do you see? This is the same patient, C and D. What do you see as a difference from one image to the other? The second image is a warm pinky? Yeah. There is something that changed. Yeah. What else? It seems that the warmth has shifted from the center to the periphery. Yeah, so of course we don't have quite the same. I think they had a blanket here over the abdomen, because of course it would be hard to get a reading on the limbs if you've got a warm belly. And so we're missing part of it, but it does look like the warmth has started to come down even here between the fingers. We can see a little bit of change. Not huge, but definitely that pinky and even the thumb are a little bit different. And so this is a study that was done at a center in, I believe it was Tübingen, Germany, which is a really big research place for people who have scleroderma and have accompanying Raynaud's phenomenon. And they went in and they had a thermal camera. And the difference between C and D is that for the right hand, they just applied some olive oil. They just rubbed a little olive oil over the person's right hand. But it's interesting. It made a little bit of a difference. You can say, well, maybe it was stroking the arm that stimulated the circulation. Maybe the oil gives a little bit of an insulating layer. Maybe there's something about oils that's warming. If you've had a nice massage, I think you can experience that. And now this is a second image. What do you see there that's different? Looks like they put one hand in something cold, right. So here, the left hand, we had green fingers, and now they've become blue. So something happened that the warmth changed in the left. How about the right? So you're right. They could have put somebody's left hand in cold water, and maybe that stimulated more warmth production, which flowed to the right arm. Could be. So let's see, we were talking about warm hands and cold hands. And did they stick this poor patient who already has scleroderma and Raynaud's phenomenon, did they stick their hand in ice water? Or did they stick their other hand in hot water? What the world did they do? It's kind of tantalizing, I think. Well, actually, they applied an oil again, and it was an oil that contained rosemary. It's all. And I've talked to the people who did the study. It was very simple application. It was like a glove up to the elbow. They just rubbed it on. They waited either 5 or 10 minutes, and they took a thermal image. That was it. So rosemary, which was probably in a base of olive oil, that's why you would do an olive oil application to see what is the difference in the active ingredient. Rosemary brought this tremendous change in warmth. So what do we know about rosemary? This is the audience participation part of the morning for the next few slides. It increases circulation, it stimulates circulation. Yep. Improved memory. Mm-hmm. Good blood flow to the brain probably helps with that process. It tastes, thank you, I was waiting, I was hoping someone would appreciate rosemary as a dish or as part of a dish. Yeah, what does it taste like? I mean, do you make a rosemary smoothie? Not so much, but roasted dishes with rosemary are great. It's something that reveals itself in warmth. The plant itself prefers warmer zones, absolutely. So it helps with prevention of the burning of meat. It's a beautiful antioxidant. That's great. Again, it's working with warmth. It's modulating warmth, it's organizing warmth, it's shifting warmth. And yes, you only see rosemary growing in really warm climates. Healthily, happily. I mean, here in Colorado, you grow rosemary and it's about this big. But you visit other places and I haven't even recognized it because it looks like a tree. It's so happy that there's so much warmth and so much sunlight. So the effect of topical rosemary essential oil was that tremendous change in warmth for the patient with scleroderma. And if we had to choose a name for the type of warmth activity of rosemary, we might say that it helps with stimulation of warmth or encouragement of warmth. Okay? So that's one example of a type of warmth. So another interesting way to think about warmth are the parameters, top warmth and lowest healthy warmth for a human being. Hyperpyrexia, heat stroke, really becomes a problem at about 104 degrees Fahrenheit, 40 degrees Celsius, which doesn't mean that if you have a fever of 105, you're going to get heat stroke, because a fever is a orchestrated, regulated warmth change. But if you are in the desert and it's 110 degrees outside and you can't sweat enough or breathe fast enough to remove your warmth and your body temperature gets above 104, that's when you become at risk of heat stroke. How about the other end? Well, we'll get to that in a second. This, what's really interesting, obviously a hive of bees, okay? I don't know if there are any beekeepers in the audience, but what are these bees doing? They're bearding, yes. You can find very dramatic pictures of this, where at a certain point, the hive gets too warm, and the bees will go outside, and they make this kind of beard where they're hanging onto each other. They go outside of the hive, and they beat their wings, and sometimes there are a bunch of them at the entrance to the hive, and they are working to circulate air to keep the temperature at a certain level. What is the temperature that bees try to keep the nest under, the hive under? Rough guess. It's 104 degrees. I'm sure there are some variations, but in general, bees try to keep the temperature of the hive below 104. A nice picture, that's from honeyflow.com. If you want to learn more about beekeeping. Here's another picture. This is a thermal image again of hives. This is in the winter. We can see at the top of the hive, the entrance is going to be down here at the bottom, but at the top of the hive, lots of warmth activity. And the bees will actually work in a concerted manner where they all come together around the queen, and through movement of their body, they're creating warmth. They need to eat a lot of honey during this time to be able to keep this warmth going. And they are working very hard to keep the temperature greater than 95.0 around the queen. And 95.0 is the temperature where we become at risk of getting hypothermia. So there's something very specific about bees and their social relationship, how they work together, how they can sense the temperature. Because the queen doesn't tell everybody what to do. I've kept bees for some years, and it's really, really interesting. There's nobody in charge. The queen is actually being cared for and laying eggs most of the time. And the workers are constantly being turned over. They only live about 30 days in the summer. But there's this broader consciousness about warmth that keeps this regulation going. And so if we had to think about honeybees and different kinds of preparations, usually low potency homeopathic, but other ways of using honeybee venom, apis or apis, is helpful with orchestration of warmth. And if you think back to that fever curve where somebody is going along and there's a big push to increase the body temperature, one of the anthroposophic medicines that's used for fever has ingredients that come from bees, from honeybees. And it's very interesting because it's not a fever suppressant, but it's kind of a fever organizer, a fever modulator, and people feel better. One of my children, when she gets a fever, she can take that medicine, and within about 15 minutes, she just totally calms down. She still has a strong fever, but it's okay. It has some form, it has some organization. So for Rosemary, we said there was a kind of stimulation or encouragement of warmth. And for honeybee, apis, we could think about an orchestration of warmth. Here's a third study, trying to find a third type of warmth. This is for pain. And one of the anthroposophic treatments is a kind of massage called rhythmical embrocation, or rhythmical Einreibung. And so this is a study with 100 patients, chronic pain that were treated 3 times within 24 days with an oil that has solum, and solum is peat moss. A prospective observational study, 100 patients, not gigantic, but not bad. Conclusions: the high effect sizes indicate that repeated rhythmic embrocation with solum oil may improve mood, pain perception, and the ability to cope with pain in patients with chronic low back pain. So just 3 treatments. And what's interesting about peat moss, where does it grow? In the moors, Scotland. This is a sunny day in Scotland. If we took a statistical average of days in Scotland, it's usually, or more often, gray and cold. So this picture is a little bit deceiving, but this wetness and this deep, deep cold. And yet this is a plant that manages to live in this environment, to thrive in this environment. And peat is very interesting because it's used for pain within the anthroposophic medicine for a lot of applications. It's also used for different kinds of sensitivity to the environment. people who get very bad joint pains when there's a storm front moving in, or people who get migraines when there's a storm front moving in, or people who are very, very sensitive to sitting in front of a computer for a long time, or there are places where, like Fukushima or Chernobyl, where there was a radioactive exposure, and you're saying we need to create some kind of sheathing for people, that Solum has proven to be helpful in those situations. So this is working with warmth also, but it's a different type. What would you say is a word? We had stimulation of warmth and orchestration of warmth. Say it louder. Dissipate the warmth. I think that the experience is a little bit different. I mean, it's absorption, but my feeling with it, because sometimes sitting with a patient, it really becomes, oh, this person needs warmth, right? Maybe they've got really cold hands. Or they have the fever and say there's something important happening with warmth. And this one is most helpful for this kind of sheathing or protection of warmth. So we started with measurement of warmth and flow of warmth, and now we've got types of warmth, which becomes really fun. I have to say, it really becomes exciting to start thinking this way, and also to understand that there are these friends for different types of warmth. This is a Colladny plate. If you've ever seen, this could be a whole nother weekend that would be really fun to do. But basically, there is a metal plate. It's the same metal plate each time. And there are very small grains of sand on it. And it is attached to usually a speaker, although I've also seen it where you just take a violin bow and stroke it on the edge of the metal plate. And when you reach a tone, the sand moves. And they're very characteristic patterns depending on whether it's C or B or G. And so these are different patterns, different archetypes of sound coming into a spatial form. And I think if we consider warmths, we could say, all right, maybe Rosemary is one kind of pattern, or one gesture, or one personality of warmth, or one kind of being of warmth. And we could say the honeybees are different. Still warmth, but a unique quality, and we could say Solum is something different. Lemon is actually used a lot within anthroposophic treatments for that phase when somebody is really, really heated through with a strong fever, and now you want to help dissipate warmth or move warmth. There's a way to do lemon juice compresses on the calves that can bring very fast relief. Where you say, I'm not really sure, this person seems confused or disoriented or very uncomfortable, and this will change. Onions, we also use onions when we're cooking with warmth. They taste very good. That initial study looking at acute respiratory infections and earaches, onion compresses are very, very helpful for congestion in the ear. That's part of how you don't need antibiotics so often. It's a different kind of warmth. And lastly, an example would be ginger. Lots of different good uses for ginger. I can share that as part of an anthroposophic training, there is a nursing treatment where fresh grated ginger is applied over your kidneys as a compress, and you lay with it for about 15 minutes. And I reacted beautifully to it, got very red-faced, and after the treatment, for about 36 hours, it felt like I had a heating pad over my kidneys. Very, very strong, deep, penetrating warmth. So these are just examples of archetypes of warmth. And this is a kind of third level. So what step did we just take? Within anthroposophic vocabulary, it's often described as the level of the astral organization, or the formative soul forces. Facts, flow, qualities. What, when, how would be a question we could use. Measurement, patterns of change, gestures, and archetypes. Again, earth, water, air, fire. Anatomy, fluids, sensation. There's a wakefulness about this, or a consciousness about it. And if you're trying to say, okay, what is the difference? How can I observe it? We can think about, we went from mineral to plant, that a plant grows and changes in time. It has a time existence to it. And if we're looking at this aspect of gesture and archetype, when you get to the animal world, there's wakefulness, there's movement, there's many, many different types, different qualities. We can observe in a person the difference between sleeping and awareness, wakefulness. And just to say, again, on the anthroposophic level, it's usually described as the astral level. It's often described as the soul level, because we also have a whole range of archetypes of feeling and of thought, which can also be worked with therapeutically in a similar way. Okay, we've done 3 out of 4. Fourth step. Is aiming for a normal temperature the best goal? This is from the American Academy of Pediatrics, their guideline on fever and antipyretic use. This is from not too many years ago, 2 or 3. And they say, fever is not the primary illness, but is a physiological mechanism that has beneficial effects in fighting infection. There is no evidence that fever itself worsens the course of an illness or that it causes long-term complications. This is also quite different than standard of care, or usual practice, I should say. Maybe this is standard of care, but this is very different from usual practice. And they go on to say that fever retards the growth and reproduction of bacteria and viruses. We know that there are good aspects of fever, that the body is creating it on purpose. And that it says here at the end that fever actually, limited data have revealed that fever actually helps the body recover more quickly from viral infections, although the fever may result in discomfort in children. But this means that if you can work in a different way with the discomfort, that the fever is actually a very good thing. So that's not so strange. I want to expand that a bunch. This is a study from 2007, pediatrics. This is probably one of my favorite studies. They say clinical case reports have suggested that behaviors of children with autism spectrum disorders may improve with fever. They conducted a prospective study of 30 children during and after an episode of fever. And they used what was called the aberrant behavior checklist. And they looked at behaviors during the fever, once the fever was gone, and then 7 days later, 7 days fever-free. What they found is that on this checklist, symptoms of irritability, hyperactivity, stereotypy, which is using stereotyped motor movements, hand flapping, head banging, repeating specific phrases over and over again, which are common in children who have more severe autism spectrum. That plus inappropriate speech, they all went down during the fever. Lethargy scores went up a little bit. But what they found is that the effects from fever persisted in the less sick patients as well as those with more severe illness. So there's something about a very strong experience of warmth that makes the child feel more comfortable in themselves. That when we get to this fourth level of anthroposophic medicine, we're looking at how do I feel in myself as a human being? How do I feel comfortable in where I am? And I don't have a clinical study of it, but I have lots of anecdotes of families where their child goes through a strong fever and the child behaves differently after the fever. That a fear has gone away, some kind of need has resolved. So their conclusions, these data suggest that these changes might not be solely the byproduct of general effects of sickness on behavior. More research is needed to prove conclusively fever-specific effects and to elucidate their underlying biological mechanisms. So we can say it has these demonstrable effects and that they had a different experience of self. If you look in the literature at some of the follow-up to this study, there was a lot of interest about what is the specific intracellular signal that makes the brain behave differently. Because if that could be synthesized, then you could give it in a tablet form or a liquid form to children with autism spectrum disorder, and it would change their behavior. I think that's jumping back several levels. It's looking for the specific piece. And it's so easy for us in medicine to do that, to go back to the specific structure. All right. This level of the I is, I think, what was changing for the children. So one more study, and then we'll do another stretch. This is a study from 2008. This might be my all-time favorite study. And they say warmth is the most powerful personality trait in social judgment, and attachment theorists have stressed the importance of warm physical contact with caregivers during infancy for healthy relationships in adulthood. Makes sense? Intriguingly, recent research in humans points to the involvement of the insula in the processes of both physical temperature and interpersonal warmth or trust information. And so they hypothesized that maybe there's an overlap, that experiences of physical warmth or coldness would increase feelings of interpersonal warmth or coldness. And so they did this great study. It happened at several different universities where they had college students who were met at the building where the study was going to happen. They were met in the lobby by a study coordinator. They would get on the elevator, and the study coordinator always had, I think, a clipboard and a cup of coffee. And they'd get on the elevator, and the doors would close, and somehow the study coordinator always needed to tie their shoe. So they would hand the cup of coffee to this college student who was participating and lean down while the elevator's going up and do their shoe, and the doors would open, and they'd get the coffee back, and they'd go in, and that was the study. Very sneaky. The cup was either hot coffee or iced coffee. Isn't that brilliant? This is why this is my favorite study. Then the college student got off the elevator and was asked to evaluate the personality of another person. It was videotaped, so it was completely standardized. They looked at them, they had a rating scale. Participants who held a hot cup of coffee versus iced coffee on the elevator judged a target person as having a warmer personality, which was defined as more generous and more caring. Now they said, Well, coffee smells really good. And maybe just the smell of warm coffee makes you happier, makes you more relaxed. So they did a follow-up study. In the second part, participants were asked to evaluate a therapeutic pad, which either got hot or was cold. You know, how is it built? Does it seem sturdy? Would you use this? What do you think of the color? What of the size? These kinds of things. Then, at the end, as a thank you, they were said, or they were offered either a gift right away, which I think was a Snapple drink, or here's a coupon to go with a friend to get some ice cream somewhere. So it was an immediate reward versus something that you do with somebody else later. And what they found is that those who held a hot therapeutic pad were more likely to choose it was a gift for a friend, not just going with a friend, it was a gift for a friend. They were more likely to choose the gift for a friend later by holding the warm pad. So there's something about our whole humanity and generosity that has changed with warmth. Outwardly, experiencing physical warmth supports warmer social judgment, makes us more generous. Inwardly, our I, this aspect of how we feel in ourselves, it's enhanced through warmth. We find greater experiences of self. So the level of the I organization, facts, flow, qualities, meaning, the level of meaning in medicine, of identity, what, when, how, why? Why is this illness happening? And we get into a level of more spiritual and developmental orientation. I will say in an average day seeing patients, it is not easy to always get to this level. But at least if we can acknowledge it, we can work towards it. Certainly we can do measurements and we can look at dynamics, and you can work a lot therapeutically with gestures and archetypes. And sometimes you connect to this richer spiritual place. Earth, water, air, fire. Anatomy, fluids, sensation, regulation would be another word for this level. Mineral, plant, animal, and the human being. There's something different about being a person, and part of that is being self-aware, the self-reflecting aspect. And anthroposophically, the physical, the etheric, the astral, and the I. Measurements of warmth, processes and dynamics of warmth, qualities and archetypes of warmth, and then at the level of the I, developmental meaning and morality of warmth.